What we have is a voucher where we want to give you $10,000 for you to go and get some very specific tests. What we have done is to make the tests age appropriate.
Those were the words of the Honorable Minister of Health, Dr. Frank Anthony, speaking at the distribution of the newly launched Universal Health Vouchers to the residents of Windsor Castle on Friday last. While in Region 2, Minister Anthony also distributed approximately 150 newborn cash grant to mothers at the public hospital Soddy. In his address to those present, he highlighted the government's initiatives centered on providing children with the best possible start in life. Following this, the minister commissioned a 43 million Guyana dollars Siemens mammogram machine at the public hospital Soddy, geared toward enhances early breast cancer detection and eliminates long-distance travel for screenings. He then embarked on a visit to the Husker Joseph District Hospital, the construction site of the 6.6 billion Guyana dollars Lima Regional Hospital, and the 881 million Guyana dollars state-of-the-art nursing school and training complex. Wrapping up his regional activities, Dr. Anthony engaged with teachers and students at the Exceptional Learners Center in Cotton Field in observance of World Down Syndrome Day. On Saturday, March 22nd, His Excellency President Dr. Mohammed Irfan Ali, alongside Minister Anthony and other officials, turned the sod for the 831 million Guyana dollars Campbellville Polyclinic. Speaking at the ceremony, President Ali said that the health facility is called a polyclinic and not a clinic or health center because it will be providing diagnostic and specialty care to residents.
There are 5 things about the polyclinic that we must know. One is that it allows for early and accurate disease detection. It supports timely intervention that supports saving lives. It is an important part of improved patient outcome. It is an essential part in information, in informed decision making, and of course, the economic value it brings.
Meanwhile, Minister Anthony said that the new facility will allow for additional services to be offered to residents.
You heard some of the things that we'll be doing, but we want this entire area, all the vaccinations that we'll be giving, we want to make sure that every child would get those vaccinations right here. We want every child who we are screening through our school health program, that if they have to be referred, that they will come here and get some of those services done.
Sunday, the minister traveled to Region 6, launching the region's first ever patient care assistant training program, where over 200 individuals will receive training to support nurses and healthcare professionals in delivering quality patient care. While delivering remarks, Dr. Anthony noted the significance of the training initiative, urging participants to see it as a beginning of a broader career path in healthcare sector. He also commissioned a mammogram machine at the New Amsterdam Hospital and highlighted the significance of decentralizing breast cancer screening services.
If we are going to screen people to know whether or not they have breast cancer, one of the more reliable types of tests that we have to do is the mammography. But up to maybe a year ago, we only had one mammography machine in the public system. That machine was at the Georgetown Hospital. And think about all the women who were eligible to do a mammography test having to travel all the way to Georgetown Hospital to get that test done. One of the decisions that we made in the government is how can we decentralize this service. Last year, we bought 4 new mammography machines. And we placed one in Linden, we have one here in New Amsterdam, we put one at Soddy, and we put one in Lethem.
Later that day, he conducted site visits to the construction site of the New Amsterdam Hospital and the nursing school and dormitory to assess their progress. Monday, March 24th, the Presidential National Non-Communicable Diseases Commission hosted an award ceremony for 15 students who participated in its first ever essay and poster competition. In his address to those present, Minister Anthony highlighted the school's health program, which plays a vital role in promoting healthier lifestyles among students. On March 25th, the Government of Guyana, Mount Sinai Health System, and HES Corporation signed a 5-year extension of the National Healthcare Initiative, which aims to transform Guyana's public health system by 2030, ensuring world-class healthcare services for all citizens, especially vulnerable communities. Speaking at this event, Minister Anthony highlighted that the partnership with Mount Sinai has been pivotal. Meanwhile, His Excellency Dr. Mohamed Irfaan Ali emphasized that the healthcare excellence should have no borders, stating the government's goal is equitable healthcare access in every region, providing all Guyanese with timely, quality, and effective care. Thereafter, he attended an inaugural meeting of the newly appointed Board of Directors for the 2025-2026 term at the Georgetown Public Hospital Corporation. Following this, he conducted a walkthrough of the $200 million retrofitted boiler room at GPHC. This major refurbishment is aimed at enhancing the efficiency and reliability of the hospital's heating and sterilization systems, as well as ensuring improved patient care and operational sustainability. Thursday, the Ministry of Health's National Tuberculosis Program, in collaboration with PAHO WHO, launched an updated tuberculosis guidelines aimed at improving the detection, treatment, and management of TB cases across Guyana. This concludes this week's edition of Week in Review. Remember to take advantage of the Universal Healthcare Voucher program available for both adults and children at all health facilities across Guyana.